I want to thank everybody for coming out here tonight. It's a little snowy, but I think Syracuse people embrace the winter more than anyone else we know, and I think it makes us tougher and better looking, too. We're going to talk about the natural facelift, which is a trademark facelift. It's a new design that I came upon or designed myself. And we're going to talk about a little bit about the aging process. We're also going to show you pictures of all these people are people that have had surgery by me. They're not photos out of some other book. Obviously, Maureen is our spokesperson. We've been friends for years. She actually had her eyelids done several years ago, and then you know, she's she's a very high-profile person and wanted to look good, and she felt good about herself, but wanted to feel better about herself. And she came to me and said, you know, she really didn't want to look like anyone else. She wanted to have, you know, a natural appearance, and certainly the natural lift fit her perfect. What's good about Maureen, though, she's just the more you know her, the more you realize how altruistic she is. She wants to share this. She doesn't get paid for this. Okay, she just does. She comes here and talks to people, really, because she wants to share her experience, and it was a positive thing for her. We do throw her in some free treatments and trinkets once in a while, but she doesn't actually get any money. Okay. A little bit about myself. I am an MD, Ph.D. I was the first MD, Ph.D. at the Medical Center here in Syracuse. My Ph.D. is in immunology. My surgical background, I'm board certified in otolaryngology, head and neck surgery, and facial plastic surgery. I've done almost 4,000 facelifts in my 25-year career, and there's been extreme advances in facial surgery in those 25 years. 25 years ago, people used to have general anesthesia, would be stay in the hospital, and a 5 to 6 week recovery. Now we're doing these operations under local anesthesia with light sedation, similar to like a colonoscopy, or even lighter. Some people even do it under a straight local anesthesia. We have an accredited OR right in our office, and that's very important because we have the same accreditation as the University Hospital or any hospital in New York State. And we have the most obsessive compulsive nurse. The inspector for AAAHC has been doing it for 10 years, has done over 70 inspections, and they never gave out a perfect score. We got a perfect score. And I mean, they shake you down. They check your needle packets to see if the dates are correct, okay? So we're very proud of that, and it's a huge effort to have an OR like that within your office. It gives patients a lot of privacy, though, because patients, you know, you don't want to go in with somebody that's, you know, having a tonsillectomy and, you know, having your facelift next to them. It also allows me to hand select my staff of people who that's all they do. They're not doing a hip operation the next day or, you know, some other operation. So they're very skilled in what they do, and so we can be very efficient at what we do. If I brought the same operation to the hospital, it would take me 3 or 4 hours, and it takes us about an hour and a half to 2 hours. Here's me. Geez, I need a hair transplant, I think. What do you guys think? Maybe it's got to be the lighting, right? It's got to be the lighting. I guess I kind of said all that. Some of my memberships, you know, those are important. Really, if you don't know your doctor, or if he's not a doctor that you know locally or know his reputation, really look up to see what he really is. You can check that he says he's a member of the board. You can actually check that, okay? Also check with the hospitals. There's been a lot of doctors, and the worst case ever was a doctor that came here from a foreign country, claimed he was a plastic surgeon, long story short, he had 180 malpractice cases, 12 RICO violations, and never even, you know, had a residency, okay? That recently happened with Kanye West's mom, okay? Some guy convinced Oprah he was a surgeon to the stars. He had no training. And she, you know, he did some ridiculous, you know, 10-hour operation in his office, and she passed away. So, if you don't know the surgeon, do your due diligence, okay? And also ask before. Don't keep the slide there. I want to because we're going to get into the meat of the talk. Don't ask another doctor who's good at something, because they'll tell you who their golf buddy is. Okay, ask a nurse, preferably if you know a nurse or an OR nurse, because they work with all the doctors and they get to see the quality of the surgery. So if you happen to know a nurse, preferably an OR nurse, and they're loyal to the patients, not to the doctor. Okay, so that's a real you're including your own doctor. Okay, who may refer you to something. Make sure that doctor is experienced in what he does and gets good results. Okay, there's no one better than an advocate for surgery than yourself. Okay, so we're going to talk about a little bit about aging and beauty. A couple things that these two people have in common is they have very youthful skin. Okay, and just like a baby has beautiful skin and cheeks, they have fat, okay, and their skin and their collagen in their skin hasn't been stretched. Clearly, Marilyn has much more definition, but still, she has a lot of fat in her cheeks. Her collagen hasn't broken down, and when your collagen breaks down, you can develop sags and wrinkles, okay. And there are really 6 basic pillars to like preventing, or delaying or making the aging process more pleasant, okay? The first pillar is how you pick your parents, okay? And that's the most important pillar, and that's one we can't do a whole lot about, okay? The next pillar is the environment, okay? How you interact with your environment. If you're in the sun and wind all day long, you're going to get wrinkles, okay? So sunblock, creams, hydrators, antioxidants, which Wendy's, it's Monique, right? Monique will be talking a little bit about the end. Those are all, so you can do something about that. And certainly, a baseball cap, sunglasses, all those things are really important, okay? The third pillar is your nutrition. If you're eating Twinkies all day long, you're going to start to look like a Twinkie, okay? And, the healthier you eat, the healthier you eat, the healthier you're going to look, okay? And that includes things like, having antioxidants and vegetables, vitamins, antioxidants, again, nutrition, and be hydrated. Drinking lots of water is a biggie. The fourth pillar is really more prevalent now than it probably ever was. Toxins you ingest, okay? Alcohol, tobacco, and drugs, okay? Those things will crush your face. My friends that went to college with me that smoke a pack a day, they look like they went to college before 1900, okay? They really accelerates aging, okay? Especially when you amplify it with drugs and alcohol. So, you can have a smoke once a month, a cigarette when you enjoy it, preferably not at all, and alcohol in moderation. But if you use those things heavily, you'll be in trouble. The fifth thing that you can, the fifth pillar to having healthy, skin is really kind of what you put on it, okay? And there's a lot of really good vitamins, antioxidants, hydrators. Those are all really critically important. And then the sixth and seventh pillar, there's actually a seventh pillar, which I'll talk about it right at the end. One of the most critical factors is stress. Stress will accelerate aging as fast as a pack of cigarettes. All right? So stress control in your life is really important. And we all have friends that are stressed out and they don't look good, okay? And we show it in our faces. Doctors, a lot of my patients are stressed out, so I talk to them about stress. There are things you can do about stress that are really simple. One is, the most important thing, don't stress about things you can't do anything about. Okay, that's really the key. And a classic example that I see, my boyfriend left me, my husband left me, my wife left me. I am really stressed out, okay? And I want to do something bad to him, I want to get back at him. I'm really mad. that is counterproductive stress, and it will get you nowhere. It will make you worse. Good stress, now you can put that in what I call good stress. You know, the jerk left me. I'm going to do something for myself. I'm going to lose weight. I'm going to get in shape. I'm going to take care of my skin. I'm going to start eating healthy, and I'm going to meet someone better than him. Okay, and that will make you feel good. Okay, so any level of stress, no matter what it is, you can put in that A column of positive stress. And doctors that are successful are masters at that. Okay, I mean, I'm stressed out all day long, and I really go back to my A column, like how can I turn that into a positive event in my life? Okay. And the seventh thing, actually the seventh, did I say sixth? Seventh pillar, we'll make up one. The seventh thing you can do is the services that a qualified surgeon can help you with, and the thing we'll talk about tonight is the natural lift and other things. Okay. Go ahead. We really, we kind of talked about all this, okay? Now, actually, she's probably the epitome of sun, alcohol. I'm surprised there's not a Lucky Strike hanging out of her mouth. And, you wouldn't want to have her for your mother-in-law because she would definitely stress you out, okay? Versus this lady, okay? She's probably of the same age. She looks, a lot happier and healthier, okay? Okay, Mary, go to the next slide. Also, what not to look like, okay? There's some horrific stuff. Most of it is in New York City and Los Angeles, fortunately, okay? And if there's any reason why Upstate should succeed from New York City is this kind of surgery. Now, because it's so overdone, it looks ridiculous. Now, this is what we're going to talk about, the natural lift, okay? There's a muscle that envelops the face. We call it the SMAS. It's the key muscle. It's the muscle all doctors tighten in a facelift. It's like a big barber strap that goes from her ear. It goes from ear to ear and supports the jowls, the chin, and the neck. And if you pull it too tight, it's going to distort the mouth and give you this joker. It will flatten the midface and give you the joker look. And it's like a band. So if you're pulling it in that direction, you'll get it to look. No matter what direction you pull it, it's going to distort the mouth laterally, which looks very unnatural. What I kind of stumbled across in thinking about the problem, so if you got someone with sagging jowls and loose neck skin, you're limited of how much lift you want versus how freaky you want them to look. So, and what our trademark concept is that the muscle, if this is the muscle we're tightening, okay, I actually split the muscle and dissected it out separately. So I get two planes of lift. The first lift lifts the jowl in this direction and only lifts the mouth up, but not laterally. And then the other plane is to lift the neck posteriorly. So it's two planes of lift. And we actually, and I was just counting on a qualitative difference. We actually are getting 2 centimeters more lift on each side. That's a lot. It's almost an inch on each side more lift than any lift known to man. And that's why I trademarked it, okay? And it's called natural face lift, okay? And we're real excited about it. And I'll show you people that we did and why that looks good, okay? There are also other things that really help. And we do a lot of things like Botox, okay? You get wrinkles because you have hyperactive muscle, especially in the forehead and around the eyes. And judicious use of Botox is wonderful, okay? It can smooth your forehead, get rid of your deep crow's feet, and really do a lot. Again, judicious use in small amounts with conservative doctors, okay? Go on to the next slide. Actually, we advertise, one of the things about this type of surgery, it's really mostly word of mouth. Generally, doctors don't refer patients other than their wives, and and you do market by advertising, okay? And that's the nature of it, okay? And it's actually fun dealing with that whole world of marketing and advertising, getting your message out. And certainly Maureen has helped a lot with that. Here's the muscles we're talking about. You can see that if you're just lifting, okay, you're going to pull laterally, and we actually split this whole envelope here and this one gets lifted that way. And the real big difference we've seen really is in this muscle here, pulling it that way, which tightens the neck and the jowl without actually distorting the mouth. Okay, and it's amazing, and it will even be better seen when you actually see actual photos. Go ahead. No, it doesn't really. You know, it doesn't. I mean, none of these people have any facial weakness. Okay, that's because it's in a different plane than when the nerves run. So the nerves to these muscles are completely intact. So we're kind of splitting it between the nerves, kind of innervate from here, coming this way, and we split it this way, really avoiding the nerves. So the muscles were fine. Okay, that's a big part of facelift surgery is, you know, being in a different plane from where all the nerves are. Here's a pretty classic kind of case we're seeing is a middle-aged female who had the natural lift, and you can see she's got pretty significant jowls and loose skin. Now she's got a lot of loose skin here. In order to totally correct that, the pull on that would really distort her mouth, and you can see that is an extremely natural mouth and jawline. Okay, and she's got wonderful structure. Okay, I'm also going to show you people with great structure. Some people have great bone structure and mobile skin, and they're going to get kind of this, classic look, okay? There are other people that don't have that. They'll have weaker bone structure and heavier skin and variations of that, and I'll show you those people. They still get good results, but they're not going to be as sculpted as someone like that, okay? And that's very important to understand, okay? All right, next slide. She also had some laser, but also here's her lateral. Again, I never got, up until we started doing this natural lift, we got very good results. We didn't get results like this, okay, with that type of neckline, jawline, and, and that type of tightening of the neck without distorting the corner of the mouth. Go ahead. I think she did, not by me. She's from the Finger Lakes area. She had a little bit, I'm not sure, she looks a little over-rotated, okay? I do a lot of nose reconstructions, and to me, without, and I'm going to talk to her about it, she looked like she had too much cartilage resected in here, and her tip rotated up. But I have not really talked to her about that. And so unless she brings it to my attention, I didn't want to make her feel bad. She looks so, she looks so pretty. Here's another patient who's, she's just about 60. She's got jowls, and she's got some aging around her eyes. And, she said she just didn't feel good. She was depressed about her appearance. And you can see how great she looks and how happy. We didn't tell her to smile, but they're pretty happy, okay? I also did a very subtle blepharoplasty. See her eyelid there? Just get rid of the hooding. Don't change never change your brow, other than a real subtle amount laterally. Someone tells you to do a full brow lift, that's the worst thing you could do to someone. I don't like the look, and usually it's overcorrected. I like a little bit of lateral brow, and I'll show you that in a couple people, okay? Here's her lateral. You see that hooding there, just that little bit of skin, and how nice that can look, okay? And she is happy, and I tell patients, we operate not for vanity, we're operating on emotions. People come because they don't feel good about the way they look, okay? They may feel good about other things. They want to look better, and whenever you get up in the morning and you look in that mirror, if you look good, you kind of feel good, okay? And the days, I know when I was in college and I would go out and have some fun, too much fun. My head was all swollen. I think I didn't feel good because I didn't look good, Okay. Here's same age, actually more aging in the neck. Again, a really great result without any distortion of her mouth. Okay. She's actually a wonderful lady and speaks so. She's a special ed teacher from the Finger Lakes area. Okay. And she doesn't have a right angle neck, and she said she never had it. That's a pretty good neck, okay, coming from there to there. I never got a result that good before, okay. Now people ask, see those creases there? Those people don't see those creases because they expect creases there, right? It's a natural at the junction of the ear and the face, so that's her incision there. And she's only like maybe a month out, okay? And that will fade. And as long as you put it in a crease, the eye doesn't see it. So we put it in front of the ear and the crease behind the ear, okay? This lady's got just incredibly, I did not really she's got incredible bone structure, and I didn't really recognize it until after I did the surgery. I mean, I knew she had good bone structure, but I didn't really fully appreciate it because she kind of had a lot of men and women age. The tissue drops, and they get an oval face, which is very attractive, into a square face, which it can be more suitable for man, but women don't like it. And this squareness, you know, and you can see she's got just a great oval face. Now, remember I was talking about a subtle brow lift? See that lateral brow there? That is sagging. That part of now, if you lift that up, she's going to look startled. So I have an operation that it's called a lateral endoscopic. We do it for a little incision up in here where we resuspend that brow. And you can see how, I think it looks fantastic, but not startled, okay? We actually call that the natural brow lift, but it's really a lateral endoscopic brow. Sometimes this part's actually too low. It's actually pulled down, and she has these creases. So our brow lift that we do, we give a small amount of Botox here and tweak that up and see how, so that goes up a little bit. These muscles tend to pull that central brow down. So you can create a tremendously natural looking brow, which is, if you get, one of the nicest things about a woman's eye is having this space visible and clean. See that? Right there. And she didn't have it there, you know. So you want a nice clean space there. Okay. All right, Mary. Here's her lateral. You can see that's nice and looks good. Okay. Incision. Okay, Mary. Now I'm showing her because she looks absolutely lovely when you see her, and she's so happy. But I'm showing her because she had the sags, so she also had a lot of wrinkles, not just sagging, and that won't go away with a lift. And we couple it with what we call fractional laser, which is a laser that resurfaces and tightens skin, and it does it in such a way that the previous CO2 silk touch lasers would do that, but it would take weeks, if not months, to recover. The recovery is anywhere from 5 to 14 days with a fractional laser. And it really does great in this zone here. Okay. It does it, the technology is incredible. The previous lasers would shoot the laser beam and the whole spot would be totally vaporized. The skin and it would tighten the collagen is how the laser works. But it did it one solid spot. The fractionated laser is like a little shotgun blast. It's got little pellets of the laser. So there's skin spared and skin treated. So there's actually skin that was never hit with a laser, and it allows for islands of skin to recover quite rapidly. Okay. All right. Right here, she's local. I don't know if anybody. This is Regina Black. She's a great person, personal friend, and she lets us use her story. She had a lot of stress in her life. She had double mastectomy from breast cancer, and her son became paralyzed all within like a year. And she said, she's sad. So she felt very unhappy, and here she is after her, natural lift. Okay. So I'm very grateful that she. Here is. Where's Barb? Barb's, thank you, Barb. Barb's a good friend of mine, and she's a Ph.D. in clinical psychology. If you need a good psychologist, someone to talk to, she's the one. She actually practices out of her house on Maple Drive, and she's just an incredible person, even just to talk to. Okay, and I don't need a psychologist. I just like talking to her. What I want to show about her particular situation, she lacked volume. She's thin. She doesn't have. Remember, I showed you the baby at Maryland, and part of her. So, she's really hollow through here. Okay, and she had a lift previous, and it didn't really solve that problem. So what we did, We did a combination of micro droplet fat injection to build up a base, and we've been augmenting it with injectable Radiesse. So she every probably 6 to 9 months, we do an injection in there, and just gives her that volume. Okay. Yeah, the Radiesse lasts anywhere from 9 months to 2 years. Okay. We inject it right on the bone to puff it out, so it does last a long time. But what's that? Radiesse is calcium hydroxyapatite. It's actually what makes up your bones. It's innate to you, and since it's in your bones, you can't be allergic to it. So injecting on the bone is just a natural substance. It's really an incredible product for resculpting the face, and it's been around a while. I don't particularly like it for soft tissue injection, other than in these folds here. It gives you a lot of volume, and what's nice about it, instant. It's also great for the jowl. If you have jowls, we inject a lot. If you have a jowl here, we can inject it right between the jowl and the chin, and we'll pop that little space out and get rid of your jowls instantly. So, calcium hydroxyapatite, Juvederm, Restylane, and all those are fillers. They give you volume. So they actually basically replace your fat and your collagen. So they give you volume. Botox is a neurotoxin, and it weakens the nerves that go to the muscles, so those frown lines smooth out. Okay, so that's the difference. It's a neurotoxin, and it's a great product. Okay. I wasn't going to show her, but we've shown a lot of slides, and we have really hundreds of people, and try to select them out. I wasn't going to show her and Mary, the real boss at the office over there. She said we got to show her. So, and what I really like about her is how great her eyes look. You know, she really looks like my grandmother up there. I had a Polish grandmother, and I was always eating her babkas and pierogies before they were done, and that's the kind of scowl I got from her, along with other things like spoons and whatever. But you can see jawline. She had pretty heavy jawline. Now in her, we also put a little grafting here. Her hairnet lines are so deep. Some of the tightening the neck we take out and put it back in there to give her a really much better area here. But she's really pretty in person, and she felt that this is not the way she wanted to age. Okay. All right, Mary, next one. Another one, and I really, her eyes, again, here's another one who I really, the eyes were, I mean, we're doing all this down here so people see your eyes. Women have incredibly beautiful eyes if you get the eyelid right and make them happy, okay? And you can see, I think that's quite a difference, okay? Okay, Mary. Yeah, she's had quite a bit of skincare things, okay? Hydration and good skincare and laser and stuff. She had laser resurfacing and things we do to plump up the collagen. But you can see how great her jawline looks and how happy, you know. And she actually, yeah, go back to that. Mary Kate, Mary gets so, I don't put these cartoons in there, Mary does. She's like a little puppy dog who gets excited about her cartoon, and she couldn't wait. And she has a dog named Opie that's the same way. So you can see that she actually had gone through a lot of stress in her life. But she's a teacher at what's called cooperative college. They teach disadvantaged people that didn't get a high school degree. And she'll talk to you too. She's actually one of her spokespeople. If you want to call and talk to her, she's delightful. Go ahead. Great. Well, sometimes, no, there are people that are smokers. You don't have to be a smoker. She wasn't a smoker, okay? And there are called smokers lines, but the reason why people get it is because some people are very animated, they use their expressions a lot. They'll use their brow, they'll scowl, they squint, they do this, and she uses her mouth. She's an expressive person, so she's got hyperactive muscles around her mouth. So we resurface that with either a laser or a diamond dermabrader, depending how deep they are, or a combination of the laser and planing down. But you also got to do a little those are muscles. Remember we talked about muscles. We inject those with Botox to weaken them to get a good result, okay? All right? Because not all smokers get it either. So it's the people who have the hyperactive. And it has to do also with volume. She's lost, since she was a little girl, she's lost a lot of fat in her face, okay? And that's part of her genetics. Say when, I guess this is the lift here. Say when, keep going. I wish it was that easy. Don't forget men, because men are important. Men like to take care of themselves. We do probably 15% of our facelift patients are men. We have a lot of men with blepharoplasty and eyelids. Men more so than women. You have to be very conservative. Women are used to change. They change their hair, they change their makeup, they change their clothes. Men, we're knuckleheads. We're not used to change. We're knuckleheads for a lot of reasons, but so you have to do a very conservative blepharoplasty and more of a conservative lift, okay? But you can see all those things that bothered him were gone, okay? Men are actually doing it more because our folks used to be able to retire when they're 55 and 60. You can't retire now on $800 a month anymore. So people are having to work. Guys that were, I see guys that, I'm a sales guy. I can't walk, I can't have my clients say, my clients say, were you out drinking last night? Because they got bags, etc. Okay. So they really, they're driven by kind of economic reasons. They want to look good and whatever. Okay. This is another lady who really, her eyes are real critical, okay? And she's we love seeing her. She's like the sweetest lady you could ever meet in your life, okay? Yeah, you just can tell. She lights up the office when she's there. And you can see that she also had some laser for her, wrinkles. But really, we did her lower eyes where we took out the fat. We do that from the incision on the inside of the eyelid, so there's no scar. And then we have a laser to, now she actually had a previous skin cancer on that eyelid that we took off before, but she still was a good candidate. Yeah, it really, the laser actually tightens the skin. You don't want to have an incision on the outside of the skin with very few exceptions, because that will, if your doctor says, I'm going to put an incision on the lower eyelid, just run. Because that will alter the shape of your eye. It creates what's called round eye, and you'll see there'll be a little bit misshaping of the eye. Okay? So the incision needs to be on the inside, which is technically really challenging, but once you learn it, it's easy. And most doctors rather make an incision, right on that lower eyelid. But the scar, the upper eyelid's okay because it will actually pull the eyelid up, the scarring and the healing. The lower eyelid, it will pull it down. So it's a very risky thing. Okay. Does someone have a question? Well, that's a great question, okay? We give patients 50 days or 50 miles, whichever comes first, okay, on the facelift. No, that's very good. The day I'm done with your surgery, you're going to continue to age, okay? Now, if you go out and gain weight and smoke cigarettes and drink and go to the Caribbean and have the time of your life and come back 50 pounds heavier, you're going to stretch yourself out again, okay? If you take care of yourself, you'll get somewhere between 12 and 15 years before you would need what we call there are things called tuck-ups, secondary lifts, we call them tweak lifts, where we can do little adjustments. Now, I saw a lady the other, she wasn't planning on losing weight. In 1 year, she ended up losing 30, 40 pounds, and she's got a little droop just at 2 years out, so we're going to do a little tuck-up, okay? Now, you'll always look better at every phase of your life, though, okay? the average person, we take 1.5 inches of skin off of each side when we tighten those muscles. That's always gone. So you'll look better at 60, 70, 80, 90 down the road. Okay? So it does last your whole life, but it doesn't stop that aging process, which is different for everybody. It really depends on the patient, okay? Some patients don't have a lot of fat in their face. And if they have a couple teaspoons or tablespoons, we can suck that out with a liposuction in 10 seconds. But if they're real heavy and have a couple pounds in their neck, that they should lose some weight first. Okay. Now, a lot of those people I showed you had classic, great bone structure, good chin neck definition. Here's someone who doesn't. Okay, she's got weak cheekbones and kind of this is not her bone. This is really skin and soft tissue, and her larynx is really right there. Okay, she doesn't have a right angled neck with her larynx there, so she's not going to get a right angled neck. But that's a great result. She's very, very, and we actually probably see more people more like her than we do the sculpted people. Okay, and when people come in with, if someone like her comes in with a picture of, Heidi Klum, you really gotta talk to her, okay? Okay, because, and here's another one. She had been rejected by 3 other surgeons. They felt they could not help her. She has the rather weak bone structure, but very thick, leathery skin. Okay, and she's probably my best of all the stuff I'm proud of. It's this late because I think I helped her more than any of the other people. Because now she's got a balanced profile. She doesn't have a heavy neck, and she is happy. Okay, so this, and without this new type of lifting, I would not get. She's got a neck now, Okay, so sorry about that one. But go ahead. Go ahead. You had a question. Go back to that one. That's pretty. That was a go. I don't see these till the day of the talk, so I don't even know where Mary gets these things from. You're spending too much time online, Mary. Okay. Here's a little bit about the fractional. We already talked about the fractional laser, how it will improve your skin quality by getting rid of the wrinkles, and it tightens the skin by tightening the collagen. The laser wavelength is matched to that of collagen. So when the laser energy hits the collagen absorbs the heat energy and tightens. Okay, they actually have studies showing the collagen is like a slinky. It gets stretched, and the laser actually tightens it. And I actually see it while I'm doing it. When we're doing this, you can see the skin go. Shoot. Yeah, some people need little tweaks and touch-ups. Okay, there are several modes. There's more aggressive modes for one-shot deals, and then there's lighter modes for people that don't want downtime. Okay, there's stuff that's like 1 day downtime, and you could have 3 sessions, or one more aggressive treatment. Okay, you could do anything. It's just that you can look like you got a bad sunburn. Okay, people can't go back to work. You can pretty much do anything. Okay, you don't want to go in the sun, but I hear some of the. I mean, this is just this. That's kind of what you look like on day 4. Okay, you see like a bad sunburn, and it also is really good for hyperpigmentation. Okay, and like lines out there. Actually, these are not my. These actually aren't my photos. These are photos from. I said all the surgical patients. These are patients that we get results like that. These are from the Fractional laser company. Eyelids are critical. Okay, that nice clean eyelid is what we all want, with that nice space up there, a nice smooth lower eyelid. And lower eyelids are a lot tougher. A lot of times we have to use the laser, a little skin tightening, fat removal, and even some injectables to fill in little troughs and stuff. Okay. If the upper eyelid is hanging over or touching the actual true eyelid, or interfering with your vision, insurance companies will cover that, okay? It can offset your costs. So that's, and we do go over that. You do have to have a visual field test to demonstrate that, okay? And we kind of talked about all this, you know, there's fat removal, there's skin removal, okay? But it is really critical. Here's a little bit of where we make that in the lower eyelid. We make that incision down there, and there's fat pads along that inside of there, okay? And you know, so we don't, this is an incision on the underneath of the eye, which I really don't like because it will distort that lower eyelid, okay? This incision, when it heals, actually lifts the eyelid up a little bit. Tightens it. No. We kind of flip you flip the eyelid inside out. Oh, we take the fat out from the inside, and then we treat the surface of the skin with a fractional laser. That's what tightens the skin. No, just the fat. There's 3 separate fat pads that we dissect out, but there's no mucosa or skin taken. No, there's no stitches. No stitches, yeah. You can't, because actually that mucosa would rub against the eye, and if you had a stitch there, it would really be uncomfortable. And it heals in 2 days. Okay, keep going. Here are just some of the costs, okay? Most of what we talked about is that the natural lift, okay? That actually includes, since we have our own OR, if we had to go to the hospital, one of the reasons why we developed our own OR, because we would price ourselves out of being able to do the surgery. If we had to take this cost and add a surgery center fee, which is about $2,500 to $3,000, and an anesthesiologist fee, it would double the cost. And most people, that's affordable, okay? And we have a thing called Care Credit, which a lot of people finance it, but you get up into $10,000, $12,000, it kind of scares a lot of people. That's pretty funny. Okay. Yeah, we have the on-site financing, okay. We also have, we do laser hair removal and laser treatments for the skin. We're actually, we need more room for exam room and stuff, and we can't handle this kind of volume. And we're really seeing, we're increasing our marketing of some of the laser services, and we're actually going to be moving that thing right next door to the, everybody know where the YMCA is? That little strip mall, and there's an eye doctor in there. We're going to be in there doing probably some consults too, some laser hair removal, hair treatment, some skincare things. Okay, what's that? It's, you know, the YMCA is in Fayetteville, in that strip mall in the Fayetteville town. What is the town center called? It's a great location. I'm going to turn. Actually, I wanted to, before Monique goes, I was going to have Maureen. I asked her to talk for a couple minutes. You can ask her a question, and then we're going to turn it over to Monique. Okay. And Monique's going to talk about some she has to offer. Okay. And you know what? I should probably give you the. You guys are a great audience. If you want to, yeah, I'm going to give it to you. But you guys seem like a great audience. Sure. We're going to stick around. If you have any questions to ask me afterwards, or if you have any kind of personal things about yourself, it's kind of hard to do a consult here, and we violate all privacy laws. So I could give you we could help you kind of thing, but you would have to get a consultation in the office. Okay. We have 4 board-certified anesthesiologists on the staff. 90% of people, we do what's called conscious sedation, where I'm certified in conscious sedation. We have a nurse that's certified in conscious sedation, and we give you like the colonoscopy drugs, which are Versed and fentanyl, which is very safe. Okay. 7 to 10 days. Okay. Maureen will tell you a little bit of. Maureen's pretty tough. We actually did her eyelids, and she was on the news like the next day, her upper and lower eyelids. Okay. and she'll tell you about her face. You know. So I'm gonna give her the mic. $5,000. No, the consultations are for free. We don't charge for the consultation.
Cool. Thank you. Thank you, Dr. Halliday. Okay. I'll just hang on to this. Everybody can hear me okay? So I had my natural lift about a year ago. It'll be a year ago in March. And it is everything that Dr. Halliday described it to be. And it was so easy. Like, where to begin? The operating room in the office makes a big difference. You're not going into this clinical, scary hospital setting. And the staff, as soon as you walk through the door, it's like the happy place. They just know that they're transforming lives, and they've done it over and over again. Everybody is so positive and affirming. You just feel embraced from the moment you go in there. So if anybody does do a consultation, you'll see exactly what I'm talking about. Everybody is just so happy. And the conscious sedation that Dr. Halliday talked about, it really is great. I know he said Versed and one other thing. I don't remember what it is, but you don't care what they do. And you're awake, but you're also, you forget. And I've told this story before. So I was awake, and I'm aware that they're working on me, and I don't care because these drugs are designed for you not to care about anything. And you could just, they're working on Dr. Halliday. He's talking, and then we were starting to tell jokes, and I was telling jokes that I know, and everybody's laughing, and then they'd start telling a joke, and I just remember at the end I'd say, I didn't get it. Everybody's laughing but me, and I thought, I don't get it. And you know why? It's because the drugs are so effective at making you forget anything that you forgot the beginning of the joke by the time you got to the end. So if anybody's worried about, wait a minute, what do you mean I'm awake for all of this stuff while you're cutting 1.5 inches of skin away, you're not going to care, and you really won't remember much about it. And then the recovery was really easy. They will give you, I think, Mary, three days of the pain, like the narcotic, the good stuff, the pain medicine, and the good stuff. And I took it right to the end. And I really had no pain. I mean, I just knew, I was looking at the clock. I said, okay, whatever the hour was, I was okay, I'll take some more. And I really didn't have any pain. After that, I think that they say you could take, like Tylenol. And I think I took that for, a lot of people don't take it, but I'll bring it on. It was great. And then the only thing that I was a little bit uncomfortable with was in the back, like Dr. Halliday said, you'll get an incision in the front of your ear and in the back of your ear. And then I remember when he told me he was going to do that, I said, don't let my ear fall off. But he said, no, that's not how it works. But then under the back of your hairline, they'll just shave a little bit of your, it's just the bottom of your hairline, and then they'll do a little bit of a cut back there, like within your hairline. So once your hair grows back, like 1/4 of an inch, they shave off the bottom, and then you can't even see it when the hair comes back. Those were actually some staples back there. That's the good stuff. That's really pulling you back. And I remember the night before, it's like 9 days, I think, right, that the stitches are in. I think it was the night before I was getting the stitches out and the staples out. And you have to lie on the back. I remember they were like bothering me. Just the last night. I didn't sleep well the last night before I was getting the stitches out. That was the only annoying thing about it, and that's how I would describe it. It was one overnight of annoyance. I'm thinking, get these things out or I'm going to pull them out myself. So that was the next day, and it doesn't even hurt to get them out. And yeah. Yep. When you go home, you're bandaged up pretty well, and you're instructed to just go home, go to bed, rest, and then the next day you go in, and then they will remove the bandages, especially the ones that are behind the back of your head. And then you're told to go home and go wash your hair, which is such a great gift. So wash your hair, and then they give you an ACE bandage, and you just wrap it around yourself. You just, you wrap it around like 3 times, and it's like Velcro, and it just stays. I think that was about the 9 days, right? The 9 days that you had the stitch. And the whole thing is for your own benefit. You can take it off and go grocery shopping or Yeah, but it's to your own benefit to wear it because, as Dr. Halliday was saying, when he separates the muscle and the skin, the muscle goes back, and you really do want the skin to, follow along. So holding it nice and tight is really to your advantage. You don't have to wear it if you don't want, but you'll get more of your money's worth if you just keep it on around the house. But if, like you had said, Mary, if you need to go get groceries or run a quick errand or have an appointment, you can take it off. And I had a tiny bit of swelling right here, just a tiny bit, but I'm not sure that anybody would have known what it was from. They might have thought maybe I had dental work or something, But yeah, I really wasn't at all unsightly. I mean, you can go to work, but if you're dealing with the public, you might look a little bit. You might have some explaining to do, but you could say I had a bad sprain of my jaw. I'm sure you'll come up with something creative. But I mean, you can easily walk around and Yeah, you have to sleep on your back and then slightly elevated for about the 9 days, a couple of weeks. Yeah, right. They want you above your heart, above just slightly elevated. And I'm a stomach sleeper, so yeah, the stomach. Yeah, I don't know. That for some reason I didn't mind that. I didn't mind that so much. Yeah. I knew that I was going to be gorgeous. Yes. Yeah. Yes. Oh, well, I have a daughter who thought this was the most amazing thing. She says, Mom, you go. She's 26. And then my boys thought, why would you do that? They're in their early 20s, too. And boys, they just so love their moms. They think, you look great no matter what. So, but they were supportive. Well, it's funny. Christian is the one that was still living at home at the time last year. And yeah, it probably took him, 2 or 3 weeks or something. Well, the first time when he saw me and he sees me with a bandage around, he says, oh, Mom, why did you do that? Well, 3 weeks later, and then he just kind of forgot about it. It was just around the house. And then 3 weeks later, one day he was looking at me and he says, you really do look younger. And I thought, yes! He was I could see he was really studying me. And he says, you really do look younger. I think that he was just my word for it until then. But then he really, he saw the proof. Any other questions? Yeah. These are just stitches. Yeah, just the regular stitches, whatever they're made. Oh. No, you wouldn't see anything, no. If you went to the grocery store, you wouldn't see. I mean, in your hair, it was probably just a pink line. I think I had it's a pink, I don't know if you can see what you can see now, it's been almost a year. But I think that for a while, if you really looked at me from the side, it was a light pink line. I don't know. Can you see anything now at all? No. No. Okay. Yeah, I know. I like to talk.
I can really ditto all that Maureen said. I have a really good memory, but to tell you the truth, I don't remember surgery that much. It seems so insignificant. You go in, Versed is absolutely wonderful. For me, it's my vacation. And the downtime was minimal. Honest to God, I can't remember the details. I remember the big ACE bandage, and I remember I had to walk my dog the next day, so I was out walking my dog with the ACE bandage. I've recently moved from the neighborhood. True story.
One other thing I want to both Maureen and Barb, they both had a straight, what we call a straight lift. If you have a lot of loose skin in your submental area, that's a little bit more. That's what we call the natural lift with submentoplasty. You'll get a little more bruising, and the recovery will be a little longer. When we had to do more work under here, you see those bandings where the really skin's hanging down, you have those bands there. The recovery will be more like 10 days than 7. Okay, so I want to clarify that so you don't think it's and both these guys are tough too. We get wimps. Well, but they're hardy. They're not complainers, and they just really did well. Yeah, they were motivated. Yeah. And mention our name. Forget about the truth. Just mention our name, okay? I'm going to turn it over. We'll be here a little bit for like questions. I want to turn it over to Monique, who works here, and she's going to talk about stuff that you can put on your skin. You know, I think you need this because of the YouTube. Also, if you forgot any of the stuff we said, you can go to YouTube. Make sure you get the R and G rated YouTube stuff. Okay? There's stuff that you just do what I told you. Okay?
Thank you. Everybody hear me okay? Put this on my agenda. There. Hi, my name is Monique Machadi. I'm one of the licensed estheticians here at Natur-Tyme. So, like Dr. Halliday and Marianne were showing you in the beginning what natural versus unnatural is, and it's really important to start with a baseline of good skincare and good health practices before you begin something such as this. Not that it's a huge undertaking, but you really want to get a normalcy developed before you go into the natural lift, and also taking care of it. Like you said, you can't go over to the Bermudas or smoking or eat a bunch of Twinkies. We don't want to be doing that. So we really want to press the issue about starting with a good skincare regimen or good practices, good diet, depleting the toxins that are in your diet right now, starting a good skincare regimen with cleansing, toning, moisturizing, essential for your body. So what we put together is really just a couple of things that you can start doing now on the skin basis. Vitamin A, one of the newest things out there, one of the watchwords. I know Dr. Oz was talking about it for a long time, and the doctors. I don't know if anybody watches that program as well. Vitamin A actually speeds up cell renewal. Vitamin A is also photosensitive, so you want to be careful with using vitamin A in the daytime without a sunscreen, because you get kind of itchy and kind of not happy. Any retinol or retinoic acid is really what you're looking for. Retinils are going to be a little bit more weak and not really doing what you want them to do. But it does help diminish wrinkle depth, fine lines. It helps to resurface the skin as well. Again, it is photosensitive, so if you are going to use it in the daytime, please use a stronger sunscreen or just use it at night. Really, we talked about lackluster skin, cracked lips, dryness, uneven complexion is a lack of vitamin B, actually vitamin B12, the happy vitamin that helps you not be as tired, gives you a little bit of lift in the afternoon as well, can also be used. Vitamin C helps the collagen synthesis. By that just meaning collagen synthesis, there's a little thing in your skin called the fibroblast. Fibroblast helps to build collagen and elastin. Now, as we age, everything gets slower and weaker, of course. So the fibroblast gets slower, weaker, produces weaker collagen and elastin. So what vitamin C does is it actually acts like a little bodyguard for your fibroblasts, so they don't age as intensely. So you're actually outputting stronger collagen and elastin, resurfacing the skin, giving it a plumper appearance. These are in topical products. We actually have vitamin A plus serum through a company called MyShell. Looks like this little green bottle. This is the only one we have. It is a 1% vitamin A. You can get as high as 4%, I believe, over the counter. Usually you want to speak to your dermatologist or your physician if you want any higher than that, because it is a prescription grade. But that can be found in a serum. We have the Perfect C serum, which is also a company called MyShell that we have here, which is a 17%. Natur-Tyme actually has its own, which is a 20%. That's the most stable vitamin C that you can buy over the counter. And when I say stable, it is an acid. You're getting ascorbic acid, but there are L-ascorbic acid. So you want to make sure that you're looking for a stable vitamin C, which is your 20%. You can get higher ones through a dermatologist's office or even plastic surgeon's office if they have an esthetician or a medical esthetician available, where they can do like the 25%, 27%, 30%, where you are going to get a little pinkness to the skin. Also, topically, moisturizers. You do want to moisturize even an oily skin. Needs to let the skin know, stop outputting oil. So a good moisturizer is always going to keep the skin supple and hydrated, helping to decrease the look of wrinkle depth. All right, internally what we put into our bodies as well. We have something called the Enhanced Beauty Supplement. It's really made for anyone who's trying to do, it's like your hair, skin, and nail vitamin. So it's really someone who wants to take better care of their skin and see that coming through the inside. Everything that we put into our bodies or on top of our bodies comes through our last exit out of town is our skin. So everything that we're putting into our mouth, toxins, bad diets, bad foods, type of meds that tend to dry out the skin, really is the Enhanced Beauty is really trying to help calm that down or stop that input of toxins coming out through the skin. It contains DMAE. I don't know if we've talked about that also is good. It does skin. It's actually one of the products called Skin Port. Helps to firm and tighten the skin because it increases muscle traction underneath the skin. Internally, it does help with cognitive support. MSM, which you'll see on a lot of Natur-Tyme products out here, is which is sulfuromethylene, which basically is a natural building block in your skin. If you've ever smelled burning hair, that's the methylsulfuromethylene that you're smelling. So that is in your hair, skin, nails, and it's a natural building block for those things that contain the keratin. The ALAs, which is a versatile antioxidant, not as strong as like your ALCs or your A's or your fish oils and that type of nature, but it does help to counter, especially in the skin and the facial skin. You'll see a lot of help with it there. Hyaluronic acid, does anyone know what that is, or anyone's heard about hyaluronic acid and what it does? Holds 10,000 times that weight in water, so it helps to plump the skin from the inside out. Helps to bind to water. It's naturally occurring in the body like your MSM, usually around your joint areas, elbows, knees, heavier growth there. It also helps to boost joint collagen production. So where your C is acting like a bodyguard and it's outputting that collagen, the hyaluronic acid kind of crawls inside it. It gets a little more plump, putting from the inside out. So you kind of want to do both if you can get it, which the hyaluronic acid is also found in the Enhanced Beauty as well, as long as C and A. Resveratrol, we've been talking a lot about resveratrol for anti-aging. What resveratrol does, it helps to calm down toxicity output through the skin and the body. So resveratrol, working as a strong antioxidant, helps to calm down environmental toxins as well, your sun damage, your poor diet, your toxicity that way. Also emotional stress. Like he was saying, the body reacts to stress and can manifest very differently through the face and the skin, even losing hair. I'm sure you've heard some people have lost their hair due to stress. So these are the top ones that for us, the EBA or the Enhanced Beauty area, that we think would start getting you on track. Also, any supplement does take about 30 to 60 days to show a good result in the body. You can't take it today and then expect miracles tomorrow. One thing that isn't listed on here that I wanted to talk about is sunscreen. I mean, sunscreen for me as an esthetician, I would love you to use it 365 days a year. Sun's still out there even though it's hidden under the clouds and it can bounce off of anything. And when we think that sun damage takes about 20 years to come to the surface, just think how you were out bathing in the sun 20 years ago. So a lot of nodding going on. I mean, when I was growing up, it was the Bain de Soleil for the Saint-Tropez tan. That's what everybody wanted. Everybody wanted to be brown and bronzed and baby oil outside, no sunscreen, a lot of silver screens right here. And that's why we're seeing such an insurgence of your actinic keratosis, which is your rough spots here, your premature aging. You're seeing skin cancer in as young as 18 to 20-year-olds right now. So really just taking care of that. If you look for one, you really want to look for something that has a broad spectrum that carries your UVA and UVB rays. So if you eliminate the V's out of there, it's you age, you burn. I mean, it's pretty much what it is. There's your aging rays and your burning rays. And when you think about it, your aging rays, they're an immunosuppressant. So your body has no idea how to fight those off. You're just going to age. And you're going to photo age a lot faster if you're not using a sunscreen. So for me, that's... Thank you for the thunderous reception there. But really, it's about just taking care of the whole body and the being, and really it's about looking good and feeling good. And if we can start to feel good and with our vitamins and our supplements and our diet and looking good through our skincare and the wonderful practice of the natural lift, I think we can do really well. Because you only get one face. I mean, unless you're Joan Rivers, you can have any face you want after that, as we saw. But my name's Monique. I'm actually here in the EBA area all the time. And if any of you ladies or gentlemen went to the tea party, you do have your $5 off coupons to visit the salon to get that money off. So come see us. Thank you.